Too little exercise, stress, a poor diet, alcohol and cigarettes, the unhealthy lifestyle in industrialized countries leads to serious diseases like diabetes and high blood pressure, summarized as so-called civilization diseases. Different kinds of cancer, such as lung cancer, are also assigned to these diseases. The most common causes, nicotine and tobacco. In many cases, diagnosis is often too late. 4.9 million people die from the causes of their nicotine addiction every year. The Life and Medical Science Institute at Bonn University has studied this disease and is therefore working on a chip that simplifies and accelerates the diagnosis of lung cancer.
Es gibt auf der Welt sehr viele Lungenkrebspatienten.
Worldwide, there are a lot of lung cancer patients, especially in places where a lot of cigarettes are smoked. We diagnose a couple of thousand patients every year, alone in Germany. This is directly linked to smoking. Approximately 95% of lung cancer patients are smokers or former smokers. The trend we see at the moment is a rise in female patients, and no change, or in some countries, a slight decrease in male patients. This is strongly related to the change in smoking behavior. We would like to recognize patients much earlier, when the tumor is still small, for example in stage 1, where we find small tumors and no metastases. Patients simply do not recognize cancer. They only visit their doctor if severe symptoms with coughing and sputum appear, and only then are they recognized. We are talking about stages 3 and 4, advanced tumors. Classic diagnosis is possible through imaging techniques, X-rays, computer tomography and bronchoscopy, where we insert a tube into the lung passage to see space occupying. So, we have a look at the organs locally. About 10 years ago, we had the idea that it might be possible to recognize lung cancer in the blood. At the time it sounded insane. The idea came at the point when new technology was invented, which allowed you to measure thousands of genes at the same time, so-called biocores. We thought we should test the blood and see if tumors lead to changes in the blood which can be measured. And that was our approach. At first, we compared patients in advanced stages with large tumors to healthy patients, and indeed found changes in the blood. This convinced us to undertake a controlled study, which included patients in earlier stages. We checked to see if changes were present on the early stages, and indeed this worked.
Wir bekommen das Blut in der Regel von niedergelassenen Ärzten oder aus Kliniken.
Usually, we get the blood from local doctors or clinics. Reconditioning of the blood takes place in our laboratory and includes several steps. The first step is to remove the RNA from the carrier solution. After this solution, we clear the RNA from other nucleic acids and proteins. After these clearing steps, the NRA is present as a pure nucleic acid, and we mark it with different colorants. After this marking, we put it on a glass plate, which essentially helps the device to read the different nucleic acids. The RNA selection is made electronically, and is then available as a file. We analyze this file with different computer programs, and are able to tell the patient if he is suffering from lung cancer or not.
Until the blood test gets to the clinics, more study has to be carried out. For patients, this means they must wait for approximately 5 years until they can profit from the new procedure. However, patients looking to reduce the risk of lung cancer should stop smoking. This opinion is shared by Professor Schulze.
Tumor diseases are clearly civilization diseases. A third of the population can become diseased from such tumors and also die from them. One of the most common forms of tumor disease is lung cancer, which can be directly attributed to smoking. This means smokers have a high chance of developing such a tumor. This is exactly what we must either prevent or even try to recognize early in the future.